my name is Annika. I am a student nurse at the University of Northeastern Philippines, and today I will be demonstrating to you ear assessment. Now, my client for today is a 17-year-old female, and she is complaining, or she wants to know the proper way to take care of her ears. So, before starting with the assessment, always make sure you have provided privacy to the client by closing up the curtains or the doors, as well as doing proper hygiene. Also, don't forget to introduce yourself, identify the client, and then explain to the client what procedure we will be doing and how we will be doing it, and how she can cooperate with us during this process. Now, hi ma'am, my name is Annika. I am your student nurse for today, and I will be doing your ear assessment. So, ear assessment is being done for us to be able to see whether if there are any problems with your inner ears, if there is a risk for hearing loss. So, before we start with the physical assessment of your ear, I will be starting with asking you a few questions. Would that be alright? Okay. Oh, by the way, can I confirm your first and last name? Thank you, Nicole. Now, Nicole, have you ever noticed any changes in your hearing recently?
No.
Okay. And do you have any drainage on your ears?
No.
Okay. Do you have any ear pain?
No.
Do you experience any ringing, roaring, or crackling sound in your ear?
No.
Okay. Have you ever felt like the room is spinning, or if you're unbalanced? No. Okay. Have you ever had ear infection, even before when you were a kid?
No.
No. How about ear treatments or surgeries?
No.
Right. Now, is there anyone in the family experiencing hearing loss? None. How about those old folks? Do you live in a noisy environment? Okay. Do you often go swimming?
No.
No. Okay, let's say when you go swimming, what do you do to take care of your ear? You don't know yet? How do you clean your ears?
I usually clean my ear with ear pick.
An ear pick. Do you use cotton swabs, cotton balls? No? Okay, perfect then. So Nicole, we're done with the interview. I'll be doing the physical assessment for your ear now. But before that, let me just go ahead and grab my equipment, okay? So after interviewing the client for her personal health history, present health concern, as well as family history, we'll now go ahead and proceed to the physical examination of the ears, or the ear assessment. Now, for this procedure, we will be needing a tuning fork, an otoscope, and a second-hand watch. Now, first procedure will be inspection of the auricle, the tragus, and the earlobes of the client. So we will be doing this by merely using our sense of sight to observe the external ear. Okay. The other side. Now, upon inspection of the auricle, the tragus, and the lobule, I was able to take note that the ears are equal in size as well as the shape bilaterally. The auricle is aligned with her eye corner, or the corner of each eye, and it is within probably 10 degrees angle. Now, in vertical position. Now, also, her earlobes are attached to the adjacent skin. Now, next, we will be observing the client's external ear for any lesions, discoloration, or discharge. Now, upon observation of the ears or external ear of the client, there are no presence of lesions or discoloration. The skin is smooth with no lesions, lumps, or nodules. The color is consistent with the facial color, and also there is no discharge noted on the external ear. Now, next we'll be palpating the auricle and the mastoid process. Ma'am, I will be needing to touch you during this procedure. Would that be okay with you? Alright, let me just touch your hair here. Do you feel any pain? How about the other side? Alright. Now, upon palpation of the mastoid process and the auricle, her auricle and mastoid process are free of swelling or tenderness. Now, next we'll be inspecting the external auditory canal. We will be using an otoscope for this procedure. So, ma'am, I will be needing to insert the tip of the otoscope to your ear. Would that be alright with you? Now, to view the external auditory canal in full or with the full view, we have to adjust the otoscope and, of course, pick the most appropriate lens or the most appropriate zoomer so that we can view the internal ear. So, ma'am, I'll be beginning with just gently putting this in your ear. Do you feel any pain with that? No? Okay, alright. Now I will be rotating the otoscope, okay? Give me a second here, this will be very quick. Alright. Okay, now upon inspection of the external auditory canal, there are small specks of earwax or cerumen, but it is odorless. The color is reddish brown and it is slightly moist. Now, also, upon observation of the consistency of the ear canal, the canal walls are slightly pinkish, but it is smooth with no nodules or lumps noted. And also, I have inspected the tympanic membrane. The color is slightly pearl gray probably. It is shiny and translucent with no bulging, lumps, or retraction, and the skin is intact. So now we will be inspecting the external auditory canal. We'll be using an otoscope to view the inside of the ear. So, ma'am, I will be needing to insert the tip of the otoscope into your ear. Would that be alright with you? Okay. Just tell me if you can feel any pain, alright? I will stop it. Okay. Just give me 1 moment here. Alright. Now, upon inspection of the external auditory canal, there are small specks of cerumen or earwax, but it is odorless. The color is reddish brown and it's slightly moist. Now, this is typically normal for ears of clients. Now, also upon observation of the consistency of the ear canal walls, the color is slightly pinkish and smooth without any nodules noted. I also inspected the tympanic membrane and the color is slightly pearl gray. It is translucent and with no any bulging, swelling, or nodules or any retraction present in the inside of the ears. Also, her skin of the on the internal ear is intact and smooth. Now, we will be evaluating the mobility of the tympanic membrane. We will be asking the client to blow her nose with her hands pinching the tip of her nose. Can you do that? So this is called the Valsalva maneuver. Now, ma'am, I need you to pinch your nose like this and then blow out of your nose. Okay? And I will be putting the otoscope again in your ear. Would that be okay? When I count to 3, you blow your nose, alright? Give me 1 moment. Okay, can you do that? 1, 2, 3. Do it again. Okay, perfect. Okay. Now we can also do this procedure by using an otoscope with a bulb insufflator. We will be inflating the bulb and see the movement of the tympanic membrane. But upon doing the Valsalva maneuver, her tympanic membrane flutters when the bulb, or her tympanic membrane flutters as she blows her nose. And it returns to rest when the air was released. So now we will be performing the whisper test. This is a test for us to be able to see or determine the client's ability of hearing. We'll be doing this by whispering 2-syllable words as we stand 2 to 3 feet away from the client. Now, ma'am, what I will do is I will be whispering 2 words or 2-syllable words. as I am standing away from you, you just need to repeat it back. You just have to say it back, okay? Alright. Be attentive and listen to me. I'm sorry? Yes, alright. Another one on the left side.
Boyfriend.
Okay, perfect. Now my client was able to repeat the words or the two-syllable words that I whispered. So that means that she passed the whisper test. So next we will be performing the Weber's test. We'll be doing this by using a tuning fork and putting it at the center of the head of the client. And then we'll be asking the client if she can hear the sound on both ears equally or if there's an ear that can hear better from either side. So ma'am, I will be testing your hearing ability or the equalization of the sound on your ear. I'll be putting the tuning fork at the center of your head. Tell me if you can hear the sound equally on both ears or if you can hear the sound better on one ear. Okay? Alright, so I'll be doing this now. And by the way, you just say now if the sound is no longer heard. Okay? Alright, just give me one moment. Okay, so how's that? Can you hear both? Can you hear the sound on both ears equally, or is there an ear that can hear better? Both are equal. Okay, so that means that the vibration are heard in both ears equally, and there is no lateralization to the sound on either side. Now, next we will be performing the rhyme test. We'll be doing this by using the tuning fork, putting it on the must-type process of the client, and asking the client if she can no longer hear the sound. Then we'll be transferring it to the external auditory canal to test the conduction of the air conduction of sound and the bone conduction. So I will be doing this now. Ma'am, I will be putting the tuning fork on the back of your ear. You have to tell me if you can hear the sound, and then tell me if you can no longer hear the sound. Okay? Alright. So, I will be doing this now. I'll be using my second hand watch to take note of the interval. Okay. Alright. So, on the right ear, the interval of the bone conduction through the mastoid process is 3 to 4 seconds. And the air conduction, however, lasted for 5 to 6 seconds. So, that means that the air conduction is longer heard than the bone conduction. I'll be testing the other side this time. So, ma'am, same process. Just tell me if you can no longer hear the sound, okay? Okay. Alright. Now, after performing the rhyme test on both ears, so technically the bone conduction on the right side and the left side are equal, so it is 4 to 5 seconds. However, as we proceed to putting the prongs of the tuning fork on the external auditory canal, it lasted for at least 5 to 7 seconds, approximately 5 to 7 seconds. So that means that the air conduction is longer heard than the bone conduction. So next we'll be proceeding with testing the client for the Romberg test method. This will test the client's equilibrium or balance. We'll be doing this by asking the client to stand with both feet together. So ma'am, I will be needing you to stand, please. Okay, let me put your chair aside. I need you to stand with both feet together, and then hands on the side, and then close your eyes, okay? Try to be as much balanced as possible, and I will be noting the time and the duration until you can no longer hold it, okay? Alright. You will be closing your eyes in 3, 2, 1, go. one, testing the clients using the Rumberg test. So technically, the client maintains the position actually 20 seconds and above, but there is a little or slight swaying, a very minimal swaying during the time duration. So after the assessment, we have to make sure we have documented all of the necessary findings and data, objective and subjective data that we have collected. And then, of course, if there are necessary referrals, necessary collaborative problem that is present, we have to make sure to be able to report it. Now, as for this assessment, since that my client was able to pass all of the tests and the exam for her hearing, and the first or the primary concern of the client is she's not knowledgeable as to how to take care of her ears, I will be selecting the nursing diagnosis readiness to enhance knowledge related to ear care, as evidenced by the client's desire to be able to perform proper ear care and cleaning. So that's it for this written demonstration. Thank you so much for watching and have a great day.